December already.
So this is the fix, and then we present it to council. We said that we have a closure agreement.
Called, okay. I got everybody's attention.
Yeah, right.
Okay, good evening, and welcome to the Tuesday, November 20th City Council meeting. If you could please stand for the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call.
Mayor Follendorf,
Here.
Vice Mayor Herman,
Here.
Councilmember Behill,
Here.
Councilmember Oliveira,
Here.
Councilmember Matilde is absent, but we have a quorum.
Okay. Item 2, approval of the agenda. Is there any public comment wishes to change anything on the agenda? Nope. Is there any
move to
council?
approve.
Okay.
Second.
All in favor?
Aye.
Aye.
All right.
Number 3, public comment. This portion of the meeting is reserved for persons wishing to address the council on matters not on the agenda. State law prohibits the city council from acting upon matters not listed on the agenda. Is there any public comment? Nope, okay. Oh, yeah.
Gary Gordon, 1583 Park Avenue. And I have a concern dealing with the fires that we have had. But this last year I purchased the old property next door to me, and so for 11 months I've been vacillating on what I was going to keep or whether to have it all torn down or whatever. But anyway, I approached the fire department about using it for practices, and so far they've used it 4 days. And I have to say that I've learned a great deal watching, and I'm very impressed with our fire departments, both of them here in town, and with the quality of the individuals that are participating and are involved with it. And hopefully they are enjoying their opportunity of doing demolishing work, cutting holes in walls and things. But it's been fun to watch all this procedure. But that's not what I'm really here to say, but I've talked to several of them about my concern. We all know that it doesn't make any difference where we live, whether it be the Coast Range or the foothills here in the Sierras. We're all very prone to these new fires that are coming about, the size of them and ferocity of them. My concern is that the annex does not have a way in for firefighting equipment or ambulances or whatever if the bridge down here was to be blocked in some way. And I know the most effective route would be Troy on the Ridge, eventually the connecting of Highway 4 down somewhere close to the fairgrounds as a bypass. But the city doesn't have the money to put that boulevard in. But we need to have some access that would allow for emergency vehicles from perhaps Finnegan across the creek to the annex. And you know, that could be a dirt drive, gravel or whatever, but just some way to get fire equipment or other emergency vehicles across if something happened to that bridge. In the 8 years since I built the house over there, the traffic has increased measurably, and it's very frequent that the cars are backed up from the bridge down to Mayo. And last Friday, I think it was, the logging truck accident over there, which blocked the highway for a while. So anyway, that's my concern, and I would like the board to give that some consideration, that you have a whole annex area of Angels Camp without really any protection in case anything happened to that bridge. So, thank you.
Thank you.
Thank you. Is there any other public comment? Okay. Item for consent agenda. We have one consent agenda item, which is the minutes from our last meeting. Is there any public comment? No? Okay, I'll bring it back to council for, discussion.
Move to approve.
Second.
All in favor?
Aye.
Aye. Okay, item 5, regular agenda. This is the second reading and adoption of ordinance number 481. It's an ordinance amending chapter 17.12, section 1712.020 of the City of Angels Municipal Code, the zoning map. This time I will turn it over to Amy.
Madam Mayor, council members, one correction, it's 21 parcels that we're down to. We took out 7 at our last meeting. And at long last, we are trying to catch up with our general plan. This is for consistency with it, to go to the BAE zoning. This particular rezoning has taken a rather long time, and I simply ask that you hold a public hearing and would recommend approval of this item, and would be happy to answer any questions. Yes.
You mentioned dozens of properties, so there's 21 on this thing. What's the big picture here that needs to be redone?
We still have about 200 to bring to you.
They all have to be evaluated and redone?
We've already got general plan designations assigned for them, and we'll be bringing the rezonings for consistency. And we have spoken with the people you asked us to speak with at the last meeting, spoken with the Lees. We'll be bringing a general plan amendment before you for them. And we've been playing phone tag with the cops so far, who had some concerns about this particular rezoning.
I think that's, I believe the Gomes was one of them. Maybe we're miscommunicating about the parcels I was concerned about. The parcels, I think north of the schoolhouse, the old schoolhouse.
North of the old schoolhouse.
There were the parcels he asked
Yeah.
that was separate than from this plan.
I know one of them was
Oh.
Kathy Gomes, and then she
Okay.
had 2 or 3 neighbors. I think there were 4 of them. And they were all really upset the last time. They came in late after the general plan was already approved and done.
Okay.
And they wanted to change it back to where it was.
Okay.
And they were told that it would cost the city $75,000 to do it. I'm sorry they were too late.
Gotcha.
And this would be an opportunity to correct that if that's what they want to do.
Okay. There was a group of about 7, as I understood it. And, some of them were the Lees, and the others were evidently the Gomes. I will follow up with them also.
Okay, thank you.
Sure.
Yeah, I know it was her, and then it's a couple neighbors, so there's, I
Okay.
don't know if there were 3 or 4.
Thank you.
Okay, so with that, open the public hearing. Is there any public comment? Okay, bring it back to, I don't have a gavel, so we are closing the public hearing, and we will bring it back to the council. Is there any further discussion?
I will move that we waive the second reading of the ordinance, hold a public hearing, which we've already done, adopt the ordinance, and direct the city clerk to proceed in accordance with Section 2 of Ordinance 481.
I'll second that.
All in favor?
Aye.
Item B, presentation of various resources available to the residents of Calaveras County. This time I will turn it over to Jessica.
Good evening, Mayor, Vice Mayor, council members, and administration of Angels Camp. I'm an employee of Calaveras County Public Health Division. My name is Jessica Nila. I will go ahead and turn it over to Michael Magana. He'll go ahead and introduce himself, and he'll conduct the presentation.
Good evening, council members. I'm the Michael Magana, the Health Education Program Manager for Calaveras County Public Health Division. So as Jessica prepares the presentation slides, I believe you were provided with copies of the presentation, and always feel free to stop me during the presentation if you have questions specifically on the services that we provide in Calaveras County. They've been told I have 15 minutes or so to present, so I'll try to be as brief as possible. Health and Human Services Agency, Public Health Division falls within the agency. What public health is and what we do is really the science of protecting and improving the health of people and their communities. It's really a cross between education, research, and policy. In the middle, you have public health. And what public health does is when you reduce it down, it saves lives and it saves money. For every $1 that you invest in the car seat program or car seats, there's a $42 return in avoided medical costs. When you take a look at nutrition education, for every $1 invested in food and nutrition education, there's a $10 return in reduced healthcare costs. When you look at childhood immunizations, saves about $9.9 million in direct healthcare costs, which saves roughly 33,000 lives and prevents 14 million cases of disease nationally. And if 10% of adults began walking on a regular basis, $5.6 billion in heart disease costs would be averted. So when we talk about Calaveras Public Health and the division within the agency, we're really looking at 4 areas that we focus on, which include health education, clinical, emergency preparedness, and administrative responsibilities. So I'll cover health education programs, the first being child passenger safety, then Fit for the Future, SNAP Ed, chronic disease self-management program that we do have within public health, our new oral health program, and the tobacco prevention program. The first being the child passenger safety program. This provides car seat assessments, educations, and fittings, and replaces car seats through a certified car seat technician. Last year, the program replaced over 120 car seats and booster seats to the community. Those are available again to any person living within Calaveras County who needs a car seat replaced or assessed. We do have a trained car seat technician who can also see whether or not the car seat was recalled or if there was damage done to the car seat where it needs to be replaced. Next, we have Fit for the Future, which really prepares school kids for the California physical fitness testing. We're currently in 6 schools in the county, which includes San Andreas Elementary, Moke Hill Elementary, Railroad Flat, West Point, Gold Strike, and Copperopolis. We also have the SNAP Ed education program, which provides nutrition education and physical activity within these schools as well, and resources and materials to county schools, retail sites, and at community events. Our latest program, which is the chronic disease...
I'm just curious, you didn't name any Angels Camp schools in your presentation. Why would you not be in those schools?
We work closely with the UC Cooperative Extension and split the schools that we're at. So UCCE actually has the other schools that aren't covered by Calaveras Public Health. So
What is UCCE? What is that?
UC Cooperative Extension. They also receive SNAP Ed funding through the state. We are what's called the local implementing agency, so we split the schools in which schools we're at in the county. I can find out which schools they cover and send someone an email, but I'm sure that they cover some of the schools within the area. Chronic disease self-management program, we facilitate really a peer-run 6-week workshop on managing chronic health conditions. This includes diabetes and chronic pain. Those are available throughout the county. It's a 6-week workshop that are led by trained community facilitators on those issues. So those are available. We do have a full-time staff person who works in setting those up within the communities and identifying needs within those communities and trying to meet those needs. The oral health program educates people on how to improve and maintain oral health and promotes prevention. That's a new program that started. We had recently had a health education specialist start with us, and from the end of April, she's managed to collect over 800 surveys from community residents talking and asking about their oral health concerns within the community. And I'm sure that it'll be another opportunity to share those findings once those are available. We also have the tobacco prevention program, which provides education and resources to help reduce tobacco use in adults and youth, and we work with every school to provide youth quick kits to help them address tobacco use, as well as adult kits that are available at no cost to those who come into our office in San Andreas or give us a call, and then we can mail those out to them at no cost as well. Clinical programs. The first one is the Child Health and Disability Prevention Program. That coordinates preventive health screenings for low-income and Medi-Cal eligible infants, children, and youth. We also have the Childhood Lead Poisoning Prevention Program. A lot of these programs are a lot to say. So we just kind of reduce them down to like CHDP or just childhood lead program. So this particular program provides case management of lead-burdened children and offers lead poisoning prevention resources to those available to individuals interested in the community. California Children's Services, which includes medical treatment program, that provides, again, case management that's led by a public health nurse and public health staff, and that really provides management, diagnosis, treatment, and rehabilitation services for children with qualifying medical conditions. Clinical services includes TB skin testing, seasonal flu vaccine, pregnancy testing, and immunizations to those who are eligible. We recently did a drive-through flu clinic, which garnered about 150 people just driving through San Andreas to get their flu shot at low or no cost. We also have a healthcare program for children in foster care, which assists with care coordination of medical, dental, developmental, and mental health needs, as well as provides oversight and monitoring some psychotropic medications for those clients that are on those. We also provide communicable disease investigation. This includes reportable diseases and information to our community about how to prevent the spread of disease. So all of those are monitored by the public health staff. We do now have a disease investigator on board through the county health department, as well as our public health nurses to respond to any communicable disease concerns, as well as our health officer, Dr. Kaleda. We also have maternal, child, and adolescent health. That includes home visits, perinatal guidance, and breastfeeding support by creating links to resources, education, and services. The other program that we have, it's sort of a partnership between, well, it is a partnership between Calaveras County Office of Emergency Services and Calaveras Public Health. And what we do there is we're there throughout the county to prepare, respond to natural disasters, disease outbreaks, and other public health emergencies. One of the things that was passed out to you is a bag for to get together an emergency kit. So if there's a fire, if there's some other disaster, fill those with items that you need. There's a card that includes information on things to consider for your emergency kit. They can easily be stashed in your car or at home, something that's easily accessible that people can take. And if people need them, they can also contact the public health department and get those from us. The other programs include, I won't get too much into them because I do want to respond to questions if you do have them. But they include contracts, so they handle all of our contracts with the agency, state and local partners, as well as the medical marijuana ID cards, doing policies and procedures, and safety, which maintains the injury and illness prevention program for the division. And that about sums up all of the programs that we offer, with the mighty about 20 employees doing all of this work. But those services and programs are available to those in Calaveras County, which includes, and it's not limited to, people within the city of Angels Camp.
If I might just add, I'd like to thank Michael and his team because they helped city staff and Chief Ellis in the development of our grant application for the school resource officer. So we are waiting to hear if we are successful in that application, but that was one example of how their department was supporting city staff in our efforts. So thank you for that.
Oh, thank you.
I didn't know that. Thank you. Thank you. Is there any council comment? Any public?
Go ahead. I just have a question. Oh, I just was wondering, as far as outreach to the community, are you feeling it? Do you feel that you're successful reaching all of those who are in need of the services? And is that a difficulty?
I think what The challenge that we try to address, of course, living in a rural community, there's transportation issues, there's a lot of barriers that people have in order to access services. By all means, we try to use different modes of educating and outreaching to the community. We use social media, we pay for ads on social media, we do have a staff member who does outreach within the communities, and we try to work with our community partners to provide any information that we have of upcoming events or services that we provide.
I know I was in another organization, a group of us went out for one of your special days to go through kind of a whole process of all of the introduction to what you do, and I found it really helpful, learned some things myself that I, just like, oh, okay, I didn't know that. Again, certain health things that would be important.
Was that our open house that
Yeah,
we did?
it was a special day where you went around and you got little rewards, and I forget what they were. She went from group to group. That's all I remember. It was about last year sometime. Yeah, no, I was impressed with the service that you gave.
Well, thank you. Appreciate you guys coming over here and presenting.
Yeah, and if anyone does have questions, they can always contact us directly, and they can call us at 754-6460. That's our main line that people, if they have questions, we can try to answer that for them. Thank you so much.
Thank you.
Okay, and with that, we're on to council reports, and I will start to my left.
Nothing to report?
Joe?
Nothing to report?
No report.
And the only thing I have to report is LAFCO. Last night, we approved the sphere of influence for 2 properties, and then approved an annexation for one of those parcels. So we're still waiting for application to come back to LAFCO for the second property owner. And then there was also a report out from the Cal-LAFCO conference. A lot of it focused on consolidations of districts, and also fire. Fire has been the biggest thing, wildland fires. And there were various other topics that branched out under those. And there were, one of the board members was the conference chair, and it sounded like it was a very successful event, and it was hosted in Yosemite. And then the next year's will be in Sacramento. And that is all I have to report. So, on to calendar.
Okay, tomorrow at 10 a.m., COG has a technical advisory committee meeting. IRWMA is at 9 a.m. at the TUD offices, and CPPA at 9 a.m. in San Andreas. Then Happy Thanksgiving on Thursday the 22nd. City offices are closed that day and the following day in observance of Thanksgiving. And December 4th, 8 a.m. is Coffee Talk Tuesday, and we're back here for council at 6 p.m. on December 4th.
Okay. And do we have a motion to adjourn?
So move.
Second. Third.
All in favor? Aye.
Aye.
All right.
Hope everyone has a happy Thanksgiving.
Yes.
Enjoy the weekend.
Is that a world record?
That's a record. Pretty quick.
All right. So you guys, happy Thanksgiving.
Yeah,
Same to
happy
you.
Thanksgiving. Enjoy your little vacation.
So it's